Hello, it's 12:30 p.m. here in Seoul. I'm Oh Seong coming to you live from the Arirang TV newsroom, where we're breaking into our regular programming to bring you a briefing from the South Korean health authorities on the latest developments with the coronavirus outbreak. Now we're cutting over to the government complex in Sejong City, just south of Seoul, where the briefing should start very soon with interpretation in English. And we see the official there making his way towards the podium.
더불어 이창준
It looks like he's
중앙사고수습본부 환자관리반장, 이강호 특별관리전담반장, 백음주
We will begin the briefing. We are
박종현 범정부
currently
대책지원본부
participated by
홍보관리팀장이
the
계속했습니다.
team members of the related departments, and we have the sign language translation as well. And it will be explained by Kim Gang-nip, overall coordinator 1 of the Central Disaster and Safety Countermeasure Headquarters.
3월 3일 화요일 정례 브리핑을
Let us now begin the
시작하겠습니다.
regular briefing for March 3rd,
오늘 오전
Tuesday.
0시 기준으로
As of
코로나19
midnight
감염자는
this morning, the number of confirmed
4,812명이며
COVID-19
34명이
cases
완치되어
stands at 4,812. A total of 34 have been discharged, while 28 have died. And we have another confirmed case of death, and the number of deaths now stands at 29. And we have conducted a test of over 100,000, and I send my deepest condolences to those who have been deceased. Today, we had a meeting, cabinet meeting, presided by President Moon Jae-in, and we discussed measures for sanitation and quarantine, and we reported the measures, and we also reported the countermeasures as well. President Moon Jae-in said that we are facing a very severe status where, especially in the areas of Daegu and Gyeongbuk regions. And the nation is currently combating against this disease. And all of the situation room will be converted to 24/7 monitoring situation. And he also urged all of the ministers to be on alert as well. And he also apologized for the public for the lack of the number of face masks being distributed to all of the public. And as for the quarantine measures in Daegu, about 9,000 followers of Shincheonji have been isolated, and we have conducted visiting inspections for those followers with symptoms. We also are witnessing a delay in a related accumulation of data, but as of yesterday, about 6,000 followers of Shincheonji Church have been tested. And we are currently conducting the test, and about 2,000 cases have been confirmed. As for the citizens of Daegu, about 11,000 people have been tested, and about 1,300 number of cases have been confirmed in the city of Daegu. A majority of them were followers of Shincheonji Church or their families or related people, and we are seeing the transmission of the virus through the community. And of the followers of Shincheonji, considering the fact that we have been witnessed those people with the symptoms, and in order to mitigate any harms, we need to expand the tests for the rest of the citizens of Daegu. Therefore, we will extend the isolation periods for the followers of Shincheonji, and centering around people with symptoms and high-risk group, we will continues to conduct the tests. And for those who are in the high-risk group, we will exert our efforts to take care of medical resources. In order to engage in fast and accurate testing, so we will continue to cooperate with the city of Daegu and to increase the number of visiting tests. And as for the number of beds and the life treatment centers in Daegu, as of March 2nd midnight, the hospitalization or the people who are waiting to be hospitalized or entering the life treatment center stands at 1,800, and many people are now being isolated at home, unable to find beds. We apologize for them, and the government will take our utmost efforts to resolve this matter. And the government also urgently summoned place at the Daegu, and we have prepared the life treatment center, which has about 160 beds, and we are sending those confirmed cases with minor symptoms. And we will also consulting with Samsung HR Development Center as well as the medical personnel in the Gyeongbuk province, and we will open new life treatment centers in this region. And in Mungyang, we also have the center which will be supervised by the Seoul National University. And apart from these aforementioned cases, we will consider utilizing the life treatment centers, and up until next week, we will find beds for 2,000 more confirmed cases. We will exert our utmost efforts to open and prepare the life treatment center as soon as possible to alleviate the lack of the hospital beds for the people in Daegu. Daegu City also will exert efforts and will continuously to cooperate with the central government in preparing hospital beds. And we will first move and transfer those people with minor symptoms to these life centers, so that those with high risks will be able to be hospitalized under the surveillance of medical treatments. And we will also first transfer our patients with minor symptoms to the life treatment centers, and the severity would be classified so that those with a certain level of severity levels will be treated at hospitals. And we'll protect the number of high-risk groups so that no more casualties or fatalities will occur. And the government is ready to spare no efforts to this end. And fortunately, more than 100 medical personnel have been participated for the volunteering in the Daegu city. And we have heard that they are continuously helping out in the Daegu city in the area of transmissioning of drugs as well as other related medical treatments. And we will also increase the personnel as well as the supplies for the Daegu city. And meanwhile, we will increase the number of hospital beds so that more people in Daegu can be hospitalized. We are also utilizing Daegu Bohun Hospital as well as Masan Hospital, as well as the Red Cross hospitals in Sangju and Gyeongju as well. And we are currently constructing more beds at the military hospital, which will be up and running sometime this week. We will also cooperate with the national public hospitals so that we can increase the number of beds for these confirmed cases. Currently, the situation in Daegu is, of course, in a dire moment, but thanks to the cooperation with the citizens of Daegu and the support from the medical staff, we can overcome the crisis. And once again, I would like to extend my deepest gratitude to the public as well as the medical staff who have been helping out in the Daegu region. And as for other local governments, I also urge the measures to mitigate any spread and transmissions of these virus. This is very essential. Cooperation is very essential on the local government level so that we can identify as many as patients in the minor symptoms, and we need to equip ourselves with regular systems and facilities to enable the in-hospitalization treatment for these confirmed cases. We will also prepare the life treatment center, and we will designate a number of life treatment center as well. In this area, when you are in need of the support from the central government, we will always cooperate to our full extent. In other regions, the situations are quite different from the Daegu city, but I urge that all the citizens will get ready and prepare for any following measures. As for the surveys on the followers of the Shincheonji is as follows. We have conducted our test. We have conducted and received the list of entire the members of the followers of the Shincheonji, and we also have been providing these lists to each of the cities and provinces. And each of the cities and local provinces have conducted telephone tests, and about 99% of them have been on call, and we have been identified that about 4,000 people have minor symptoms. And currently, we are conducting continuous tests on these confirmed cases. Of course, we only have about 50% of the final outcome, but we also have identified that the ratio of positiveness of the case in other regions is at about 1%. And we identified that the community transmission in other regions are low compared to Daegu, but as for Daegu, we are witnessing a rate of positive of about 60%, and we are currently investigating and analyzing the test results. As for the Shincheonji followers in Daegu, we have urged them to be isolated voluntarily, and for those who have symptoms, they are being isolated, and for the other groups, they are also being monitored by the personnel. And in relation to the fake news which are spreading, we are currently witnessing a more increased cases. And as the press release says, we have the call center hotlines at 1399, but we have some curse words, or we also have some fake news distribution regarding this, and this discourages our measures to counter the spread of the coronavirus. And now is a very important moment when we have to focus our attention to overcome the disease. I ask for your cooperation. And in order to mitigate any transmissions in the local government level, the local government as well as the central government is engaging in close cooperation. We urge that you will continuously to be engaging in cooperation and coordination, and each of the people are required to have personal sanitary measures, and we are also suggesting personal social distancing as well. We apologize for the continued delay in the starting of the schools, but I hope for your understanding. And I also would like to avoid meeting at crowded places. And furthermore, anyone having fever or respiratory symptoms should avoid having in contact with others visiting a crowded place, and they need to avoid any outdoor activities, stayed at home, and together with the help of the medical staff and the mature citizenship of the rest of the people, we can overcome the COVID-19 spread as soon as possible. I ask for your support once again. Thank you very much.
Well, that concludes our live coverage of this briefing. In our upcoming newscast today, we will have updates on all this information along with in-depth analysis. Arirang News is the place to find out the latest updates on the coronavirus outbreak in South Korea. That's it for us from now, but we will be back at 3 p.m. Bye for now.